Hello, professional nurses. This is one of the videos in a series that was requested for lab values. We're going to take a look at the normal CBC levels. What is a CBC? Well, a CBC is a complete blood count. And so we can use the CBC to identify if the patient has any infections, anemia, autoimmune disorders, bone marrow disorders, thrombocytopenia, erythrocytosis, and also different types of cancer to include leukemia. Why would the healthcare provider order a CBC? Well, maybe if the patient has bruising or bleeding, signs of fatigue, dizziness, weakness, inflammation, joint pain, blood pressure concerns. Maybe the patient has some heart issues as well. They may have some cardiovascular issues. So these are all reasons that the healthcare provider could order a complete blood count. So when we look at these values for the RBCs, notice the values may be a little bit higher for males than females. So what do the RBCs tell us? Well, the red blood cells indicates, the RBC value indicates what is going on with the actual red blood cell. It is helpful in diagnosing certain types of anemia and other kinds of liver diseases. So the other value that we see here is for white blood cells. And why are we concerned about white blood cells? Well, you may understand that white blood cells tell us if the body is infected, because the white blood cells, they are the first line of defense against foreign bodies, tissues, and other substances. So when we look at the white blood cell count, if we have an elevation in the patient's white blood cell count, that tells us that there's a sign of infection. Now, this value that I'm showing you here, 5,000 to 10,000, that is uh, the range, and that is in cubic millimeters. We could have a white blood cell count with differential, where we look at specific information on specific white blood cells. And that could be your neutrophils, your lymphocytes, your monocytes, eosinophils, or your basophils. So all of these are going to be very specific, and we'll be looking at that if the patient may have some kind of particular infection or some kind of inflammation. Maybe they have parasitic bodies inside of their system. So that's why the doctor may actually order a white blood cell count with differential. All right, the next value is going to be hemoglobin. Notice that there's a difference between males and females. So when we look at the males, we're looking at 14 to 18 grams per deciliter. When we're looking at females, we're looking at between 12 to 16 grams per deciliter. So you may be wondering, why am I concerned about the patient's hemoglobin? Well, hemoglobin is the protein component of our red blood cells, and it serves as a vehicle for oxygen and carbon dioxide transport. So hemoglobin is composed of a pigment that is called heme, and this heme actually carries the iron, a protein, and a protein, and that protein is globin. So hemoglobin test is the measure of the total amount of hemoglobin in the blood. So indications, well, why would we need a hemoglobin test for a patient? Well, the hemoglobin count is indicated to help measure the severity of a patient's anemia, and it's also meant to monitor the effectiveness of a therapeutic regimen if a patient is receiving maybe iron transfusions or iron supplements. Okay, the next value I want to take a look at is the hematocrit. So for males, it's 42 to 52. For females, 37 to 47. So what does the hematocrit tell us? Well, hematocrit is tells us, first of all, what it is it represents a percentage of total blood volume that is made up of red blood cells. So increased hematocrit levels can tell us if the patient is a burn patient, if the patient has chronic obstructive pulmonary disease, COPD. It can also tell us if they have increased hematocrit, that maybe there's a congenital heart disease, maybe the patient is dehydrated, maybe the patient has eclampsia, maybe the patient has polycythemia vera, maybe severe dehydration. So increased hematocrit levels can indicate all of those things. Now, you may be wondering, okay, I've told you what increased hematocrit levels are. What are decreased hematocrit levels indicative of? Well, if a patient has decreased hematocrit, it may mean that they have anemia, they may have a bone marrow failure, they may be having a hemolytic reaction, they may be hemorrhaging, they may have leukemia, they may have liver cirrhosis, maybe even malnutrition. They may have multiple myelomas. They may have a nutritional deficiency, or it could be normal. Lower hematocrit levels may be normal during a pregnancy. So during a normal pregnancy, that's what we may expect to see. Okay, platelets is going to be the next value that we look at. Platelets sometimes falls under coagulation studies, and we know that platelets are very important because they're produced in the bone marrow and they play a role in hemostasis or in hemostasis. So platelets function in making sure that hemostatic plug is formed, clot retraction, and coagulation factor activation. So if my patient has low platelets, I am concerned about them bleeding and hemorrhaging. So they need to be on platelet precaution. So that's the real significance of platelets. If my patient has low platelets, I know that I better hold any heparin, I better hold any anticoagulant therapy. Okay, now let's take a look at erythrocyte sedimentation rate. Sometimes it's called ESR. Sometimes nurses can say, hey, what is the sed rate for that patient? So why would we be concerned about the ESR or the erythrocyte sedimentation rate being less than 20? Well, if a patient has a decrease in ESR, it may tell us that they have sickle cell anemia. They could have polycythemia vera. But if the patient has an increased sedimentation rate or an increased ESR, it could be a sign of bacterial infection. It could be a sign of chronic renal failure. It could be due to an inflammatory disease. So it also could be due to a malignancy in the patient. So it also, an elevated or increased SED rate could be a sign of severe anemia, such as a vitamin B12 deficiency or even an iron deficiency. Okay, so this was my little summary of normal CBC levels, your RBCs, your red blood cells, your WBCs, which are your white blood cells, your hemoglobin, hematocrit, your platelets, and your erythrocyte sedimentation rate. It's really important that you understand the why of what this actually means. Yes, you need to know the skill on how to actually draw the blood, but you also need to know the why. I challenge you when you go to your clinical settings and you look at your patient's blood work, pay close attention to these values and see what the patient actually looks like if there are any abnormalities or any of these values that are out of range. Thank you so much for your attention, and remember to always think like a nurse.